So the hydration campaign is part of the antimicrobial stewardship and as part of the AMR National Ambition Plan to reduce healthcare associated infections and to reduce the antimicrobial resistance. And we all know that hydration is pivotal for all humans to stay alive, and every single cell, every tissue and every organ in our body need to be hydrated to function effectively. And I think it's really important, especially when we get older, because the ability to have a reduced thirst reflex and loss of function in your kidneys, which actually can affect the ability to retain water in your body. So it's really important to keep hydrated, particularly when you get older. And of course this can lead to increased risk of infections such as urinary tract infections, but also increased risk of falls and unfortunately admissions to the hospitals, which can be very unpleasant. So to really improve the health and the overall quality of life, we've got a multidisciplinary hydration team consisting of specialists across the Dorset, and we actually co-design a number of educational resources around the importance of hydration and its benefits. And we've been very privileged to be able to trial our first pilots in a number of care homes and at University Hospital Dorset, and particularly here in Adams Court Care Home.
So Tina came to us and she asked for a variety of different touch points in the campaign. So we made a whole suite of resources. Some of them were patient leaflets, some of them were pull-up banners, and some of them were a little bit more fun, like the tabards. So we've got people wheeling around hydration trolleys, and they've got the graphics on their tabards, so it just reinforces the messages that are in the campaign. The thinking behind How Do You Like Your Cuppa came about because we had some insight that a lot of times patients don't actually drink their cup of tea, and it might just be something as simple as they haven't been asked how they like it, they haven't been asked how many sugars they like, they haven't been asked if they like it with milk, or they haven't been asked how hot they like it, or even if they like tea at all. It might be that there's another drink. So yeah, we decided to run with that because it starts the conversation and encourages a little bit of social interaction.
I was really enthused about it. I think hydration is really important, and I felt we were really good in both homes on hydration, but I thought we could be better. And it's such a simple thing to bring on board, and anybody can improve their hydration very simply. But we wanted to make it fun for the homes as well, so we've introduced a lot of different aspects around hydration. I just thought it was really easy. It was a really easy thing to do to improve the lives of residents. We run a hydration round twice a day. That's on top of the tea and coffee trolley and the afternoon cake trolley. So we run one about 11:30 and then about 7 p.m. So on that trolley is juices, hot drinks if they want it, different types of hot drinks as well, not just tea and coffee, Ovaltine, Horlicks, all of those things that our residents in their age group will remember. Coke floats have made a huge comeback, so they absolutely love Coke floats here. And I'm not going to worry about the sugar. You know, when our residents are living with dementia and are of an older age bracket, they can have exactly what they like. Smoothies, anything, milkshakes. Moving on from that, they made fruit skewers, jellies, jelly shots. Our chef has made little jelly shots so they don't have to have a whole big jelly. And also introduced mini hand blenders. So they just make one smoothie, and the care staff can literally take the trolley to the resident with all the different types of fruit and creams, ice creams, different flavours of milk, and say, what would you like today? And they can pick it themselves, put it into the blender, make their own, they're just battery operated blenders, make their own smoothie. So it's almost like an activity as well, but they've really loved getting involved in that and choosing what they want to have. It's made a big difference. The impact on the residents has been huge. It's been phenomenal. So we've reduced our urine infections, our UTIs, we've reduced our falls. The residents just seem healthier and happier. There's been a marked difference in their sleeping patterns, they're sleeping better, and their engagement. So their engagement with activities, with each other, with staff, we've seen an improvement across the board in all of those aspects.
Yeah, well, when Pat came in, because she's got vascular dementia, so we were told that there is nothing you can do for that, no medication or anything, so she'll gradually go downhill. But she was quite talkative when she first came in, but as time went by, she got more into herself, but there would be times when she would have what they call a chatty day, and when she did, what they did was phone me up and said, "Pat's having a chatty day, do you want to come in?" So, but all they asked of me was, would I tell them how much she's drinking while I was in? So when I come in, when they come round with a cup of tea or coffee, I'll give it to her, and I'm also giving her water to drink, and I would just say how many glasses of water she's drank. Did she drink all her tea or coffee? And I'll tell them how much of that she drank. And that was they were quite happy for that information. But I would say it's benefited Pat, because you can see her skin's good, you know, through the hydration.
So the knock-on effect for staff has been a calmer, more peaceful working space, I suppose, for them. It's a stressful job. It's never not going to be a stressful job. But I think they're engaging much better with the residents. So they're getting benefit. Also for families, they're engaging much better. We've made them all aware of the hydration project through the leaflets, through the posters that are up in the home, talking it through with them. We made it part of our residents and families meeting. So just to get the message out. It's also become a bit of an activity for them. It can be very hard. People do think, you know, when they come to visit, they have to stay for at least an hour, and they must take part in something, but it can be really hard sitting with someone for an hour that is not verbal and can't give you any feedback. Whereas being part of this, you know, the hydration trolley can go into the room, or we can make up a tray, they make them smoothies, it opens up some conversation, and they feel they've had a more productive visit, I think, you know, and that's the feedback we've been given, certainly. And that goes with the staff as well. You're in this job because you want to care for people, and when you see the people you're caring for in a happier mood, being healthier, it makes your job so much better.